Volume 2 of Decolonization Pathways, Coloniality, and African Response to COVID-19, which follows Jim Spire's Volume 1 of the same series, critically examines Africa's response to the COVID-19 pandemic, arguing that health pandemics are such serious issues to be left solely to epidemiologists and pathologists, highlighting how excessive reliance on external scientific narratives deepens vulnerabilities in formerly colonized societies. Dr. David Ngendo Simba, the editor of the book, advocates for a more self-reliant and decolonized approach to public health, emphasizing indigenous knowledge and local innovative solutions to real-time challenges.
Focus of unit of analysis in Volume 1. Volume 2 takes us into the moment of pandemic that suspended a lot of taken for granted assumptions. The assumption that Europe is developed, Africa is underdeveloped. The assumption that Africa is at the receiving end of the science, and then Europe is at the giving end of it. Now, COVID-19 is having, in many ways, suspended that certainty and bringing uncertainties because of the I don't know kind of attitude that loomed large across the globe, both in the east and in the west, in the south and in the north. We saw that COVID could open up other questions, but we also saw that there are some other lingering questions which are about the development. What does development mean? What does the science mean? The lingering legacy of the north as having the biggest mouth and the little ears, that it can speak the most about the way forward and it can listen the least about what others are doing. We thought that this is the logical continuation.
The book features contributions from various scholars who analyze COVID-19 pandemic through the lens of coloniality and decolonization in Africa.
So when I discuss the issue of neo-functionalism in that chapter, I'm trying to examine the fact that the avenue for colonialism has changed, has shifted. There's a new colonial state, which is no longer in Nakasero. It's no longer in Kololo, it's no longer in Mbuya. It is in white coats with gowns and syringes and defining your life to the core of your DNA.
Is the question of biopolitics. I think that the entire book can be read through biopolitical lenses, and what we witnessed, I think, with COVID-19 was the idea that at work in this political economy of the distribution of the vaccine was not simply a biopolitics, but maybe even a necropolitics. And there was a decision about who were the subject that could die first in the global scale.
It's COVID-19 and the economic downturn of the indigenous press in Uganda. What is intriguing, 7 publications were closed during COVID, indigenous publications.
Meanwhile, Dr. Jim Spire Sentong, a celebrated academician and columnist, who is also one of the chapter contributors, urges authors to abandon traditional methods of disseminating information, such as writing journals, in favor of more digitally resilient approaches, such as publishing documentaries.
As academics, I think there is a problem that we have focused so much on the traditional modes of dissemination of knowledge, writing journal articles, write books, but we have to ask ourselves, who is reading these books? Who are we writing for? Because publication is not an end in itself. You're publishing in order to communicate. It makes more sense if you care about whether what you're communicating is being received, is being heard, is being utilized or not. Many young people are on social media today. How do we tap into social media? How do we tap into those spaces where people are? People are not going to look for us. In the past, books were few and they could look for them. You would know that, oh, there is a political history of Uganda by Karugire, and you go and look for it. But today there are so many books. Books are launched every day. We have to be very deliberate about how to get to the audience, about how to take ourselves there.
The Uganda Martyrs University Vice Chancellor, Professor Patrick Edwin Chamanywa, reiterated his university's commitment to investing more in research and academia, as he also urged education institutions to allocate more resources to research and publications.
We've decided to commit funds to dissemination of research through publication and through a university press, probably the only other press, university press in the country after Makerere University Press. And although we have challenges in funding, we believe as management, and I believe as a Vice Chancellor, that every institution has financial challenges. You can never have enough money. But as a university, we've prioritized research and dissemination of research and used the meager resources we have to still do a good job.
Professor Pontiano Kaleebu, who was the chief discussant, expressed concern over the prevailing mindset among the public that technology and scientific innovations are exclusively owned by the Western world, upon which he challenged African governments to increase funding for local scientific innovations and foster intercontinental cooperation to enhance their country's resilience and capacity in managing potential future pandemics.
Generally, COVID brought us and said we need to do more innovation. And as one of the authors says, innovation in Africa is still dependent a lot on the West, and we need to do better. The author talks about the very limited research in Africa. Sub-Saharan Africa only accounted for only 2% of the research on COVID-19. There is also lack of continental collaboration. So therefore we need new solutions as part of solving new situations.
The book's launch coincides with the anniversary of the COVID-19 outbreak, which claimed 228,738 lives as of 24th February 2023, according to the World Health Organization. This underscores the need for African countries not only to boost local research and production of medical supplies, but also to rethink health policies to reflect local realities, cultures, and needs. Joseph Kabale, UCTV News.